Hey everyone. So I know that in my intro I said I was gonna post the next video about like the supplements and whatnot that I've been taking in prep for my surgery, but I decided I would do the video about the Papillon Center and Dr. Mcginn and how my consult and everything went in January. So I had my consult on January 8th of 2013. Her office is located in kind of like a shopping center. It's really big. It's kind of confusing to find her office. We had to like turn around a bunch of times because we thought it was one way and then it wasn't. But so her office is pretty small. There's like a little waiting room, and I had my parents with me and my girlfriend, and it was actually difficult to like fit all of us in there, and then there was like two other people who were there before us. So it's pretty small because it was like I was standing and I think my dad was standing, and then there really wasn't that much room. So just know, if you go to the Papillon Center, you might not want to bring a whole brigade like I did. So anyway, we went there, filled out some paperwork. The receptionist was super nice and giving me all the info that I needed. And then, I waited around for a little bit. They were behind, so it took a little while. It took like an hour before I even got to see her. But, so I went into the room. My parents and my girlfriend came as well. But they were totally great with that. They didn't mind that they came with me. They seemed to like that I had such a big support system with me already. So I went in, and Dr. Mcginn's assistant, Heather, just kind of came in, took medical history, asked some questions. She just wanted to make sure that like I understood everything that was going on, and then she talked a little bit about getting certain exams and fertility stuff to make sure that I like knew what I could do at this point, and all that kind of stuff. So she was very nice. She was very well informed. She answered any of my questions. She answered any of my parents' questions and my girlfriend's. So then, after she got all the information that she needed, Dr. Mcginn came in and introduced herself and basically just kind of gave the lowdown on what the surgery would involve, how much it would be, what I would need to do, like test-wise, pre-op. Pre-op tests that I got, I had to get some blood tests, I had to get a chest x-ray, I had an EKG, and then I had to have a physical, and I think that's it. I had to have all of that done a month before my actual surgery. So my surgery is in May. I had to have all of that in by April. So I did that. That went fine. I had to get some blood work retaken, but I haven't heard anything, so I guess no news is good news. But anyway, so she gave me the whole lowdown on everything, answered any other questions that I might have had, and then my parents left the room, and she asked me if she could take surgery. Wow, where am I today? If she could take pictures of my chest. So she did that. She just kind of like did a little inspection just to make sure everything was okay. And then was just like confirming that I would need double incision. But she said it looked great, that I would probably have great results. She seemed very confident, which made me feel confident. So there was that, and then she was very, very kind, and soft-spoken, and I really liked her. And I think the fact that she's transgender herself really drew me to her, because she had more of an understanding of like where I was coming from, and then I knew where she was coming from, and I just feel like the fact that she knows, what it's like to be transgender herself, really helped a lot in that case. And I think she also knows that she wants to like make the job look as nicely as possible because of that. Because she just knows what it's like to be like dysphoric and whatnot. So anyway, I really liked her. I liked her assistant a lot. They were very nice, very straightforward. Didn't sugarcoat anything. The receptionist was also very nice. So they pretty much, they gave me a copy of like what we went over during the appointment, any information about like staying somewhere if I need to. I don't need to stay anywhere. I can go back home because I'm only like 30 minutes away from the area, but they give a lot of information. They tell you what you need to get in, like payment wise, beforehand. Payments also have to be in a month before the surgery, so along with all the tests and stuff, payment also has to be in. A deposit for a surgery date is $1,000. So that day at my appointment, I scheduled my chest surgery date, and then I gave them the deposit. And the consult itself was $150. So $150 plus $1,000 for the consult, and then scheduling my surgery. So I scheduled it that day, and then later on I did the testing and whatnot, handed all that in, I got in all the money that I needed to. The final bit of the money though, I think it's like $1,600, isn't due until the day of surgery. So except for $1,600 of it, which goes to the hospital when I check in, the rest of it has to be in a month ahead. So that's pretty much it for the consult part. She just, later on she said she and her receptionists, they would send in another packet like in a week or so, with more information about what's left for payments, and then like referrals and things that I should and shouldn't do beforehand. So that's pretty much it consult wise. Dr. Mcginn's really great. Papillon Center is really great. So yeah, that's about it for that. I guess I don't know. Bye.